Hello, 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 everybody, and welcome to our live of the week. My name is Cheta. For those of you who don't know me, I am the head of the EntreMD Merch Division, and I am Dr. Una's daughter. So today I'm interviewing a very amazing doctor. Her name is Doctor Cindy, so she's right here. So you can introduce yourself, and then we're going to get started. Of
Hi, everyone. Thanks so much, Cheddar, for having me on today.
course.
Yeah, I'm Dr. Cindy Ojeway. I am a board certified family physician. I am also the founder and CEO of Doctor CindyCare, which is a direct primary care practice located in Pennsylvania. If you're familiar with Hershey, we're about 20 to 30 minutes away.
Oh, wow.
And we see patients from the newborn stage to the geriatric population. And we provide family practice care via membership model. So that's what direct primary care means.
Oh, wow. That's absolutely amazing. So, how long have you been doing this?
I have been doing this for 2 whole months.
Wow. Oh, wow.
I know. We
Whoa.
practice July 9th.
That's amazing. You're doing
I
good.
know.
You're doing very good. Okay. So then
Yeah.
could you share, your entrepreneurial story with us then? So, what is your business all about and why did you start it?
Sure. So, as I mentioned, I'm a family physician. I was employed with a huge hospital system for the last 4 years. And after I graduated from residency,
Mhm.
um, I I was doing hospital medicine. I was doing primary care as a PCP, we call it. And I was also doing urgent care work. Um, and kind of got burnt out because I'm also a mom.
Mhm.
I have two lovely babies. They don't like me to call them babies. They're 10 and 7. And I wear different hats. Like, I'm a daughter. I'm helping take care of my parents. I'm a person. I like doing fun things as well. And it gets sometimes really hard as a doctor to balance all of those things. Um, with my last position, I was actually commuting quite a bit, an hour and a half to work,
Oh, wow.
and I would be working 7 days on with seven
Mhm.
days off, and it could get really tiring as a hospitalist. Um, so during those commutes to work, an hour and a half, I discovered Dr. Una's podcast, EntreMD. So I would be listening, and there were a ton of episodes listening, driving one way, coming back. And I really got inspired. And just like with the knowledge, armed with that knowledge that wow, I could actually do this. I could actually
Mhm.
open my own private practice and be successful, and I can, make my own schedule, be there for my kids in the morning, help them, get ready for school, be able to pick them up, have my weekends, have my holidays, like not have to wonder, like, oh my God, am I getting Christmas off this
Mhm.
year? And not be there to watch my kids, open their Christmas presents. So it was just that belief that I could actually do this and be successful at it. So yeah, that's my story. So once I discovered the Entre MD podcast, um, and Dr. Una has a web, like she likes to call it. I am also a Christian. I've been for many years. God is a big part of my life. Also,
Mhm.
part of that inspiration as to you can do it.
Yeah.
He said he came that we might have life and have it more abundantly. And I'm
Mhm.
going after that abundant life. So I discovered the rise and shine, like prayer
Yeah.
in the mornings. So when I'm leaving, I would listen to that along with the podcast.
Mhm.
All of these things together, and her books. I know I had mentioned before, and I have it right here. Um, Profitable
Private practice. Yes.
practice. Yeah. So reading that as well served as some of my inspiration to
Mhm.
really, start doing this.
Start doing it. That's really good. So is the Is that what CindyCare is, or is CindyCare something else?
So it's Doctor CindyCare. So it's a private practice. It's my medical clinic. So we see patients from, like I said, the newborn age to geriatrics. We are a membership based model, meaning we don't take insurance. I
Mhm.
know it's crazy. A lot of people, they get, oh, no insurance. But how I like to explain it is the patients, they pay a membership fee, and
Mhm.
with that membership fee, they get unlimited visits. They get direct access to me because that's a problem with the typical insurance based practices. They don't, like, they have to go through a whole nurse before they
Yeah.
get to the actual doctor if they have a question or anything, and then the messaging back and forth. They get same or next day appointments. Typically, if you call in and say, oh, I need to get in with my doctor, you probably won't be able to get in the same day or the next day. They'll probably schedule you out a week or two. So my practice, we try to get around all of that, and around insurance kind of dictating your needs as a patient. So with the membership fee, all of that is covered. We don't cover labs, we don't cover imaging, we don't cover, like, if you need to be referred to a specialist, but everything else tends to be covered under that model. And we see families. It can be a healthcare benefit for employers who want to give their employees
Mhm.
a form of medical care. So yeah, that's what Doctor CindyCare is about.
That's amazing. I think this is the first time I've heard about, a membership-based private practice.
Yeah,
I
yeah.
think you're doing amazing. You're doing very good for
You,
you.
thank
You're
you.
welcome.
Yeah, yeah. So there have been. It's a growing movement. It's a growing
Mhm.
movement for sure. A lot of doctors are hopping onto it.
Yeah,
It's growing. It's
it's
growing.
growing. That's amazing. And then so since starting that, because I know you did say you started 2 months ago, but what has becoming an entrepreneur made possible for you?
Oh, I love it. I love it. So I have I'm not as burnt out. So I
Mm,
was able to start taking care of me.
yeah.
Um, I I am able to. I see it in myself. I'm more relaxed. I'm not as tense. Um,
Mhm.
Enjoying the things that I used to enjoy. So I used to like to read, and for the last few years, with residency, and you only read books to get you, like, medical
Yeah,
books.
medical books, yeah.
Exactly. But now I'm actually reading for fun, and I'm reading for growth, right? So that's one major one. The second major one is my babies, who will probably not, as I said, they don't like me to call them babies, but they will forever be my
Forever be babies, forever be babies, yeah, doesn't matter how old you are.
exactly. You understand?
Yes. I still refer to myself as my
That's
mother's
baby.
baby. It's not changing anytime soon.
That's good. That's good. But yeah, now I actually can. I before, I had a lot of help from my parents. My parents helped me out,
Mhm.
especially my mom, grandma. She would, help me with getting them to school and getting them back and taking them to, like, after school activities, gymnastics,
Mhm.
soccer, or whatever it was. But now that I'm doing this, I'm able to be more present and be there and actually, help them get ready for school and have conversations, and we're bonding more. So that's one of the I think the biggest
Biggest
benefits of
thing,
doing
yeah,
that. Yeah,
yeah.
and you can't put a price tag on that.
Yeah,
And
no. Yeah, I get that. The time flexibility that you have now to be able to spend with, yourself and your family. I was able to kind of watch when my mother did that. So once she retired from the practice, and then all of a sudden my mom is at home.
well,
So
yeah,
she's the one taking us to school, bringing us home from school, taking us to the library, all of the things. And then
yeah.
the next thing we know, everybody's homeschooled. That's
But that's a good thing,
it's a
right?
good thing. It's a good thing, yeah.
That's my goal. That's one of my goals.
Yeah.
I'll get there
No,
eventually.
yeah, don't do not be discouraged. Homeschool life is the life.
Yeah,
It's
I
I
can, it's
enjoy at first, I was very apprehensive about it. It's like, I don't know that I wanna do this
sure.
because we were homeschooled, then we started going to school, and then it was back to homeschool again. I was like, but I absolutely love it. I get to do things like this, so
Sure,
I'll definitely take it.
absolutely,
Yeah.
absolutely, and you have all
So
these EBS aunties now too,
yes,
right?
yes, all of them, all of them. That's why I'm looking forward to the vision retreat. That's why I'm gonna just see everybody.
Everyone.
Am I going to help my mother? Yes. Am I also going to see the aunties? Yes.
Yes,
Yes, I am.
I love it, I love
Yeah.
it.
And so you did mention the 2 months that you started in July. And so, since starting that, what has been the scariest thing that you had to do? And then how did you stop that fear from stopping you?
Sure. So I think the scariest thing was, so in medicine, we like to be secure. We like to know, okay, this is my protocol, or this is the template that I'm following, or this, if I do this, this is what happens. Um, with being an entrepreneur, what tends to happen is you can't always predict what's going to happen,
Yeah.
right? Or you have to take some risks. The biggest challenge I would say, or was leaving the security of like a guaranteed salary, even though, I was dying on the inside, commuting and
Mhm.
working these long hours and being away from my family and all of this. um I think I the security of knowing, like, yeah, at the end of the month you get this amount. That was scary to
Mhm.
give up, even though you have a plan. As an entrepreneur, you do all the math and everything. This is where I want to be. um, I think that was one of the things that was the scariest. Overcame it by, again, my faith, my trust. I like to know and get, the go ahead, in my spirit, that yes, this is something that, I think God is leading me to do. So just having that spiritual backing, it really gives you that comfort.
Mhm.
Especially, He's the comforter, right? The Holy Spirit.
Yes.
Um,
Mhm.
so that, and then having a plan, and a backup plan.
And a backup
A
plan, yeah.
backup plan in the sense that, you have things that, you can do, to get you to where you need to be, if
Mhm.
that happens. So,
Yeah.
yeah.
That's good, that's really good. And then so I heard you spoke a little bit about how during the commute you would listen to the EntreMD podcast. And so how did you figure out about the business school itself? Why did you end up joining the business school? All of those things.
Sure. So, just like you have, all those EBS aunties, I feel like I had, like, listening to the podcast. Dr. Toomer was always on.
Mhm.
Dr. Tamara Beckford was always on, and then I think she has a spin-off podcast from the
Yeah.
MD as well.
Mhm.
Um, there were a lot of docs on there that, you listen and you hear their names,
Mhm.
and they were all doing it, and you just hear that over and over and over, and it's like, wow, they're inspiring me. Wow, I can do this too. Wow, like, this is really possible.
Yes.
Yeah. So, just on those drives, like, yeah, just hearing, everyone's story. um and it felt like I knew them, even though, but you
Mhm.
know them because you're listening to them all the time,
Mhm.
you know.
Yeah.
So, that was, yeah, that was very instrumental there.
Okay, okay, that's amazing. So did you join the biz okay, so let me see. You had the commute to work, then you were listening to then you joined the business school before you started your business?
I did.
You
So
did. Okay.
once I made the decision to start my private practice, I knew, okay, I would be solo, meaning it would just be me. I knew I needed a community to
Mhm.
do this with. I knew I needed people saying all the time, like, you can do it, it's possible, you're going to be successful. I knew that I needed to put myself in that environment to get it done. So I did enroll before I opened, um, a little before.
A little
But
before you.
yeah,
Okay.
but
Yeah.
I we tend to procrastinate a lot.
Yes.
So I think I made the decision to join like probably a month or two before I
We
actually
end up joining.
joined.
Yeah. Okay, that makes sense.
But but yeah, it's bad city. But yeah.
Yeah. It's good. Okay. And then so since joining the school, what has one of your favorite things been?
Um, there are so many. Um, so one of the favorites, I love the books that we read.
Mhm.
Again, I love the community. I love the vault because I have my own schedule behind the scenes where I'm like going through all the past episodes, and just watching everything evolve and watching people evolve, like
Yeah.
seeing everyone from back then and where they are now. um, that's really helpful. I love the growth that I've seen in myself. Like, if you had spoken to me maybe a year ago, I would never have dreamed of being here and doing this. I One of the things I forgot to mention was that I also have a podcast, which is a spinoff from the private practice. So it's interviewing like docs on just like the common questions we get based on different topics
Mhm.
in the clinic, and it's a resource for my patients. And I would never have dreamed of doing something like that. Like, I was always the one behind the scenes, didn't want to be in front of the camera, shy, like. And again, that's another thing I got from this. It's this courage and boldness um,
Mhm.
to do what I'm doing
To do what you're doing,
today.
that's good.
Yeah.
It's amazing. And then so what has one of your biggest wins been since joining, the business school?
Opening my private practice.
Yes.
Yay! I Chana, when I tell you, I would never have thought that this would have been possible. Like, glory to God and EBS as an instrument
Mhm.
to do that. Like, it wouldn't have been possible to be doing this. Like, when I walk into the clinic, seeing it, seeing just how getting everything together and
Mhm.
getting it out of my brain and into reality, like that in itself is such a blessing and one of the biggest wins ever.
Yeah.
And then now I have this spin-off with the whole podcast,
Mhm.
and just touching lives, because when you go into med school, um, you write a personal statement, or trying to get into med school, or and you say all these things that you want to do, and the impact that you want to have. And I as a Christian, I know I was born for something. I was born to fulfill God's purpose for my life, and to actually be doing that now. You can't put a price on that. That's the
Yes, you can. That's amazing. That's so good. I'm so happy for you. So I do have a question. Are you coming for the vision retreat?
Yee. Chana! So, what I'm wrestling with, I do have a prior commitment on this Saturday. So
Mhm.
if I'm coming, it would just be um, for the Thursday, Friday sessions, and then I would have to leave at the end of the on Friday. So that's what I'm wrestling with. Um, um, Everyone has been saying, Cindy, you have to be there. Like, even after I do my podcast, sometimes with the EBS members, they're like, yes, you absolutely have to go. It's like EBS on steroids was what someone said. It's like
Yeah.
you get, infused, and you absolutely need it. Um, so
Yes.
I'm leaning towards it, but I'm still working out the schedule.
Logistics.
Yeah, the schedule, and trying to figure out how it's gonna play out. That's why I'm like, "Ee."
We're figuring it out. We're figuring it out. Well, I will be looking forward to seeing you if you do come.
Yes, ma'am.
I personally think you'll have a lot of fun. So
Yeah,
yeah.
and seeing you will be one of the reasons that I'll try to make this happen.
Yes, and I may or may not be doing like a live recording. So like this,
Oh,
I may or may not. You know, you didn't hear it from me or anything. Just
may or may not.
may
May
or
or
may not,
I didn't hear
something like
anything.
that. Okay, and then so one of my last questions to you is: there's someone, let's say, who's struggling with the idea of joining the business school. What is a piece of advice that you would give to them
Do it.
to do it?
Absolutely do it. The return on the investment is so huge. It's way more than, the actual, price tag.
Mhm.
You need the community. I tell all my friends, like, you should join EBS because, you get the community, you get the growth, you get access to this whole, it's like this wisdom, like, on the prayer side, Dr. Unal calls it spiritual intelligence, but it's this kind of wisdom that just sits, in this community, whether it's through, all the videos, the people, the community, that the people that make it,
Yeah.
that are part of it, and, comprise, the whole school. It's just something in there that you can't explain, you can't put a price tag on, but it propels you years ahead.
Yes.
Because when I think about where I was a year ago to where I am today, like, a lot of that has to do with just, stumbling across that podcast, binging on it, um, and of course the prayer aspect for me. I cannot downplay that at all, as well. And then just, like, it's wonderful.
That's wonderful. Yeah.
Yeah,
So
yeah.
her advice is to just do it.
Just do it.
Just do it. Just do it. So take that
Like
leap.
Nike, like Nike.
Yes,
Just
like Nike, just do it. And then so if you have, any further questions about the business school, you can put EBS inside the chat and then the team will reach out to you and answer any questions it is that you have. Okay, so I have two more questions. Number one, where can people find you? They want to get to know more about you. They want to listen to that podcast that you have. They want to visit this practice that you just opened. Where can we find you?
Sure. So, the practice is Doctor CindyCare, and we can be found at www.drcindycare.com. We're also on Facebook, and Instagram. You can find Doctor CindyCare on Facebook. On Instagram, it's at Cindy Ojwe, MD, all one word right there. And the podcast, we're on YouTube. Yay. And it's at Doctor CindyCare.
At Doctor CindyCare. Alrighty. And so I'll just take that information and put it in the description below so you guys have easy access to it. And then my last and final bonus question is, what advice did you wish that 17-year-old you knew that you can tell me?
17-year-old you. Anything is possible. You're you were put on this earth, with divine gifts and talents,
Mm,
a divine purpose. Um, Naysayers, stay away. Just, yeah, stay focused, but anything is possible. He came that you might have life and have it more abundantly. Hold on to that promise. It's yours. And anything is possible. Of course, with him.
with him, yes.
Yes.
Man.
All who believe, but yes, anything is possible.
All
I
right.
never, and I keep saying it, I never in my wildest dreams, I was born in the Caribbean, uh,
Mhm.
born to immigrant parents, um, never thought that, I would be a physician, one, and now a physician with my own private practice.
Yeah.
And it's all because of my Heavenly Father. So, yeah. Anything is possible.
Anything is possible. All right, so I'll be taking that. The goal with me asking this question is that I want to take it and kind of put it into a book, and then hopefully at one of these events, either one of them next year, by the time I'm
Yes,
done with all of these interviews, they'll all be on the tables and everybody gets a copy. So
yes,
that's
yes,
the plan. So
Shasta, yes, I love it. The business ideas are flowing. That's awesome. I love that. I love that.
thank
Yeah.
you. Alrighty, so this has been amazing. I love this interview. I think this is going to be one of those ones that I watch 3,000 times. And then
Oh,
so all of those 5,000 views come from me and me alone. So
thank you. This was lovely
it
as well. I really
was.
enjoyed it. And now I have the another reason to be there at that vision retreat.
See? Yes, you do. Yes, you do. There you go. Everybody is slowly but surely convincing you.
Yes,
I guess
yes,
that means we'll see you then.
yes,
Alrighty. And then so if you also are interested in coming for the Vision Retreat, you will put that in the chat as well. So EBS Vision Retreat. And then I'm part of the team, but I'm not that part of the team that'll reach out to you. So that's the other side.
yes.
But thank you so much for allowing me to interview you. This has been absolutely amazing and wonderful. And I love this so much. And so to everybody who is watching, don't forget to come to the Vision Retreat with all of your EBS merch. We're going to show up and show out and
Yes,
take this really big group picture with Dr. Una. Oops, see?
yes.
Yes, see, she has her things already. See that, you know what that means? That means she's gonna be there. There we go. So
Yes, yes. I
see,
love
yeah,
it. I
she
love
has
it.
she's down packed, she's ready, she's ready. So you can scan the QR code that's on your screen and you can order your merch and then we'll get it to you. And then at the end, we're meant to take, a really big group photo with Dr. Una, and everybody has their books and their pens and their notebooks and their t-shirts and their hats and their coffee mugs and all of the things. And it's going to be absolutely amazing. So to everyone watching, thank you so much. I hope you